as a practicing clinician, you come across things that you want, questions that you want answered all the time, but don't have the skills and research to find out how to answer them. This is the perfect opportunity to do that.
Yeah, and you need a whole year to do it.
Yeah.
We've got a really strong research focus at our work as well, and they're really focused on us actually undertaking research projects and bringing our department and our trust forward. So like just to be able to do that and then to kind of help other staff undertake their own research projects, I think was another big focus for me to want to come onto the course.
I think the facilities that they do have here are great in terms of sort of social interaction as well. So when you've had those really hard lectures and you just want to come out and kind of just chill out with friends, some of the great cafes that they have here and sort of the social areas in the library and the like are really great.
Yeah. And the access to computers has been good.
Yeah. Really good. And Moodle's so useful, just being able to get onto that mini computer anywhere and be able to get onto things and be able to communicate with each other.
Doing it from home is excellent, isn't it? Because it just saves you maybe a whole day to come in and get an article, which I used to have to do when I was at work.
That's a really good point actually. Being able to access everything from home is really important.
It is, and including the lecturers and being able to email the lecturers, and they're really good at getting back to you actually.
They actually seem a really nice group of lecturers that you feel you can go and ask them questions and you feel you can get some answers fairly quickly usually, which is really important, especially when you're on a course, which can be quite stressful.
Because you're all going to have different needs as well, so it's important that you are able to see people on an individual basis at times to really discuss your particular problem in detail and get some answers.
And you really feel like they know their subject inside out.
Yeah.
Very enthusiastic about the course and what we're doing, and very interested in our research projects.
Yeah, and our supervisors are as well. I don't know about you, but my supervisor's just brilliant. She's taking a really close interest and very supportive.
I think it's great that there's just such a small number of students on our particular course, because I think it's really helped us bond.
I must admit though, because any courses I've done on has been very nurse focused or midwife focused, and it's really nice to actually work with such a big diverse of allied health professionals, because it's given you a lot more insight into what everybody else does, which is something you probably wouldn't be involved in when you were in your professional day jobs, I suppose. So I find that very useful.
I think because when you're in hospital, we work towards this multi-professional kind of work ethic, and to actually come into a university-based situation where we're all professionals, but none of us are professionals in the field of research, and so for us all to come from different clinical backgrounds and integrate our ideas together, it's quite a special opportunity. That's a big part of the whole reason of the course, is so that we take our information and actually disseminate that to our colleagues, and to have those skills to be able to go into practice and apply some of that information is just again a great opportunity.
If I think back to what I know now that I didn't 2 months ago, is actually we've covered quite a lot of ground in 2 months, and it's been quite a steep learning curve and quite challenging.
I was really surprised at speaking to some of my work colleagues the other day, and I was really surprised at some of the stuff that I was coming out with, and having only been on the course for 2 months, and actually almost amazed at myself at how much information you actually take on.
I really appreciate the difference between clinical thinking and scientific thinking now. Because I think I came in being quite adamant that I was going to think clinically, but realised that you can't, because it's not scientific. So I definitely appreciate the gap a lot more, and I think that helps in interpreting the evidence and what you're reading, and thinking about how you'll get it into practice, and then the other way around, thinking about your practice and how you might research something.